third webinar for the Nursing Now Challenge Global Solutions and AMR Futures Lab joint AMR initiative. I'm really pleased to be joined today again by a esteemed set of panelists, and we have an exciting program ahead of us. So today it will be about leadership and advocacy in antimicrobial resistance. And today we have, as I said, really eminent panelists who are speaking. We are soon joined by Professor Aisha Holloway, the Chief Nursing Officer in Scotland. And she will explain to us about the government perspective on AMR and her perspective on how nursing comes in. I'm sure it will be exciting. Then Fran Garraghan is the program lead for BSAC, and she will speak about the LEAP program. We have Sophia Sachedina. She's a program manager for global health partnerships. And Laura Ahern, who is an advanced clinical practitioner in respiratory medicine at the Northern Care Alliance NHS Trust. So, as I said, we have really, really good speakers. And please, as always, we will do presentations, but it's all about also your interest in the subject, your questions, your discussion, and we will give time for that. And myself, I'm Till Bachmann. I'm the founder of the AMR Futures Lab here at the University of Edinburgh, and I'm joined by Dr. Maneesh Paul, who is a co-founder of the Futures Lab, but he is based in India, in Bangalore. And so, Maneesh, do you want to say a word as well?
Yeah, it's a pleasure to have this conversation with all the panelists as well as the participants in this session, because the leadership part is very, very important for all of us to understand. And we really have an amazing panel over us here.
Excellent. Thank you, Maneesh. And I will just very, very briefly before we hand over, go through a few introduction slides. So myself, as I said, to Bachmann, and I want to introduce the Futures Lab and the objective of this webinar. If you have joined before, you will have heard this, but I really want to stress very briefly at the beginning that AMR is really a wicked problem which is spanning human, animal, plant, and the environmental domains. And it's very tricky to come about solutions for antimicrobial resistance because of those complexities. And especially it's about the last mile. So how to implement the ideas, the research, the innovation into activities implemented so there can be impact generated. And this is what the Futures Lab is about. So we look to catalyze holistic solutions for AMR by bringing together all stakeholders who have experience in antimicrobial resistance and innovators, and bring them together with implementers and really to come up with solutions and implement them who generate impact. And this is really the reason why we partnered with Nursing Now Challenge on AMR, because we value and the input and see the opportunity working with nurses and midwives in this respect. As I mentioned previously, that the AMR Futures Lab is set up at the Edinburgh Futures Institute, and this is really about bringing together transdisciplinary and transsectoral collaboration. And it's all about co-design and co-creation and going about data-driven innovation. So bringing together people from very different disciplines and have a local cross-linked initiative, but partnering with academic research, with implementation partners and global partners. And with that, I really thanks for listening. But we come back to this in a second, or after at the end of the webinar. And right, so you are back on my screen now. So with that, I really would like, after this very brief introduction, I would kick off with our presentations, and I would give the floor to Fran as our first speaker. And Fran, the floor is yours. If you have something to share, please go ahead. I mean, slides or just floor is yours.
That's great. Thank you, Till. And thank you so much for the invite today. I'm going to share a presentation that's got a short video. So please do let me know if you can't hear the video. Let me just... So my name is Fran Garraghan, and I am the program lead for BSAC. Before this, I spent 20 years working in the NHS, 15 of which specialising in antimicrobial stewardship. I'm a pharmacist by trade, but very much work as a member of the multidisciplinary team. So today I wanted to present our LEAP leadership programme. That's a new programme that I've been developing since I started with BSAC in January. And it's really about empowering healthcare professionals to protect lives and the power of antibiotics. And nurses are really central to our programme. So please do let me know if you can't hear this video.
We can hear it.
Personally, I've been involved in antimicrobial stewardship for more than 25 years. So it's something that is really a really deep passion for me. And I guess one of the observations over the years I and others have made is antimicrobial decision making. The vast majority of it, maybe 99% of it, is made by non-infection specialists. And that's the kind of central idea behind LEAP. So LEAP is leadership to embed antimicrobial stewardship into practice. So it's acknowledging that everybody has got a role to play in antimicrobial stewardship. Every healthcare professional has a role to play, whether you're a prescriber or a non-prescriber. Anybody who's making decisions or supporting or influencing others in their clinical practice has a really important role to play.
What I'm hoping to get out of the LEAP mentorship program is to develop some leadership qualities and help another healthcare professional put into practice antimicrobial stewardship across the hospital and wider across the primary care and maybe interim care board network.
I'm most looking forward to the networking opportunities, talking to people from other settings around the country and seeing how they're using antimicrobial stewardship in their settings and seeing how that I might be able to apply that to my own setting.
Leadership's really important and sometimes you can be a little bit alone trying to get the message across, but once we've got some leaders in this field across the country, we'll really be able to make that difference and try to tackle AMR.
Our participants will undertake workplace leadership challenges, empowering them and giving them the skills and confidence to ensure that they give their colleagues and patients the understanding about how important antibiotics are and how important it is to preserve their effectiveness for the future.
Antimicrobial stewardship is not just the provenance of infection specialists, it's absolutely everybody's business.
So I hope that just gave you a flavour.
Personally, I've been involved in antimicrobial stewardship.
I hope that gave you a flavour of the people behind LEAP and the people that really have got involved with our programme, that we only started really training for it in October. So we have two pathways for LEAP. We have LEAP into Action, which is our frontline healthcare professionals, and these are our non-infection specialists. And these are the people on the front line who are working with patients with infections every day. And the programme's open to nursing, pharmacy, medicine and allied healthcare professionals. And we've got a number of nurses on our first cohort. And really what we were asking was that they wanted to lead a local antimicrobial stewardship improvement project with some structured support. And as part of a 9-month programme, they attended face-to-face leadership training to really build that network and that awareness. And then they will be mentored through a workplace AMS challenge. And that's really something that can be embedded in their daily work. They'll participate in monthly webinars. And then really what we like to do at the end is build up some of this really great small projects and encourage our participants to present an abstract and a poster at our BSAC conference. The second cohort is our LEAP mentor cohort, and it's great to see Laura on the call today. Laura is one of our first cohort of mentors, and these are our AMS specialists and infection specialists. And really the role of a mentor is to guide the Leap into Action participant through their workplace challenge. So attend mentorship training, but also participate in this sort of 6 to 9 months of meetings, one-to-ones with their mentee, and really support them through some of the challenges that they will face in doing this. So this just gives a brief overview of our timeline. So as I said, it's really a 9-month program with this workplace challenge really embedded throughout. And really our focus is at the start to really increase skills and also confidence in leadership and communication and that behaviour change. And then we will support with specific monthly themes to support participants to strengthen those leadership skills. And then we do have evaluation running throughout our programme, but really, we want to really show the impact of this on local AMS challenges, but also on the person involved too. So just to sort of show you our pilot phase. So our pilot phase is based in the north of England, and our population are patients with an infection or who take antibiotics in the north. And we selected the north because it's an area of high antibiotic consumption, high burden of antimicrobial resistance, and also high levels of socioeconomic deprivation contributing to health inequalities. So we're really saying we could do this in any healthcare setting, and the pilot was about really trying this out in different healthcare settings. So we've got 23 participants in our pilot phase across primary and secondary care, urgent care settings, hospital at home and virtual wards. And professions, like I said, we've got a really great number of nurses acting as both on our Leap into Action course, but also as mentors as well. And we've got physiotherapists, we've got physician associate, podiatrists, pharmacists and technicians, and also doctors. So really a diverse range of professionals, but also a broad range of experience within these groups. And then a wide range of specialities. It was really great to see so many different people wanting to try and embed antimicrobial stewardship into their frontline practice, from general care to intensive care, really diverse settings across the range. So as I said, mentoring is really important, and really just wanted to share this slide with you that, mentoring is really trying to help our Leap into Action participant overcome their challenges, clarify their goals, and really try and shape realistic and meaningful actions that can have an impact on their practice and help them to move forward. And this is Debbie. And Debbie's one of our Leap mentors, who again is a nurse, and she's a lead nurse for antimicrobials. And it was really important to Debbie to be involved in this program and really try and encourage other colleagues to join the fight against AMR. And then just a final slide, just to promote BSAC membership. So BSAC membership is free. If you're not a member, please do join us. We're really trying to build a really great community, and nurses are at the centre of this. And that's it from me. Thank you.
Thank you so much, Fran. That's an amazing program, and really, well, it's an amazing program, and I'm really keen to see how it further develops. You said you started. How much experience do you have already? So in terms of do you have feedback? Do you have any experiences already you could share?
So we've just, like I said, we've just done leadership training and mentorship training in October and November. So our participants are very new at the start. And, the initial feedback was that they enjoyed the sessions, and that, they're now sort of empowered to go forward. And again, our mentorship training was really well attended. I've never been to an in-person training where everybody who was meant to come turned up and everyone got involved, and the joy and sort of enthusiasm in the room for both trainings was great to see. And just really to say to your participants, we are recruiting again for Leap Antifungal Stewardship, and this closes on Friday. So if anyone is working or specialising in an area of high antifungal use and would like to get involved, then please do get in touch.
Oh, that's fantastic. Antifungal, of course. Yeah, that's really, really important. Yes. So if attendees have a question, please raise your hand. Yeah, very welcome to come in and ask the question, but also the panelists, if you have a comment, a question for Fran, please fire off. Either now or later, obviously. We are monitoring the chat as things are coming in. So are you expecting, Fran, to you said you're having a pilot phase now. Are you expecting to set up other programs in other locations, potentially beyond, I mean, in the UK, obviously, but maybe also beyond? Is that a model which you can see being implemented elsewhere?
We hope so, and we think this would be applicable, the general principle, in different settings. I've got quite a lot of work experience in sort of global health. I've worked with Sophia, who's also on the call, and you can see how the principle of this would fit into other areas. Unfortunately, it is down to money and funding and availability, and that's why we're trying to really evaluate the impact of this from the start to show the value of it.
Excellent. Yes, I can clearly see how this will be beneficial in other places and fit also to other initiatives. And it's so much about awareness raising and coming up with thoughts and ideas and implementing them and providing the opportunity for implementation. Excellent. Thank you so much, Fran. Yes, Laura.
Yeah, sorry, I'd just really like to just give a shout out to Fran, actually, because I think as a nurse, trying to implement AMS where there's no job descriptions, as we've discussed, gaps in education, it's really important that you've got supportive networks and that you've got a place and a place to speak, but also a place to do what's important to you, where you feel valued. So I'd really encourage that if there's people on the call that's really interested in implementing this in the workplace, that actually BSAC is a great place to get that networking and support from. Especially as it is a gap in nursing and midwifery at the moment, and it'd be great to see some midwives on the course as well. So just wanted to add that. Thank you.
Fantastic. Yes. Thank you, Laura, for the comment. Now, Fran, I'm sure we will somehow come back to you as we run through the presentations, and we'll have a discussion to wrap up. But I would like to bypass my agenda a little bit and come straight to our special guest today, Professor Aisha Holloway, who, as I said at the intro, is Chief Nursing Officer in Scotland. And we are absolutely delighted to have you here today, Aisha, speaking to us about in this really important subject of the combination of efforts with nursing and midwifery and AMR. So really, thank you so much, Aisha, for making the time. And I would like to give you the floor. I know you're very, very busy, so you're still muted.
He can't hear you.
Here we go. Now we don't see you anymore. Now we see you and hear you. Fantastic. Thank you.
I was muted. I'm so sorry I'm late. Apologies. I've had some meetings this morning since 8, so just popping into this one. It's great to see you and great to be back here with Nursing Now Challenge. Maneesh and Till, wonderful to see you again. I'm delighted that I'm here, and thank you so much for the invitation. I'm obviously here now in my new role as the Chief Nursing Officer for Scotland, and as a nurse, what is very unique about Scotland is that as the Chief Nursing Officer, part of my new role is as the Senior Reporting Officer for Scotland's delivery of the UK AMR National Action Plan. And AMR and HCAI actually sit within the CNOD Directorate, so under a nurse, not a medical colleague. So that is very unusual. And I've taken great pleasure in the last 6 weeks taking up the role and being involved with the wonderful team that we have in Scottish Government around AMR. We have a couple of fantastic nurse advisors, clinicians who are just amazing at this work and really demonstrating the importance of that clinical advice of nurses and midwives and our other health professionals. So I kind of feel like I'm flying the flag on the back of the work that I've done with you, Till, where we've really been trying to push the nursing profession. And obviously, as CNO in Scotland, I also have the privilege of working with a chief midwife within my team and a chief HP and chief clinical scientist. So we cover collectively 30% of the workforce in Scotland. And I think that's where we can really start to capitalise on that workforce, and not just led by nurses, but with all our colleagues across the board. And I'm not sure if you've probably done all your kind of high level stats on that, but really it is so important for us to be working with policymakers, with funders, with researchers to really understand and raise the profile of AMR. And I know we were all involved in the World AMR Awareness Week just recently. It was one of the first things I did enroll, and there were some key messages that came out of that for us in Scotland, but also more widely, and the One Health approach. So I think really taking AMR into that sphere of One Health and understanding human health, animal health, the environment and the food chain. And for us as a workforce, understanding what our role is in all of those other areas. And I'm just going to do a wee plug here for the launch of the Scottish One Health AMR Research Register SOHAR website, which has launched recently. So I think that's a space where we're trying to push forward, and we in government want to engage with the research community in the delivery of the AMR National Action Plan in Scotland, and welcoming the efforts of our wider colleagues from different areas. And if I think back to my education as a nurse, which was quite some time ago, and what that looks like now, I do feel that there is a need for stronger curricula in this area and stronger interdisciplinary working, not just within that clinical setting, but in that wider research policy setting also, because without everyone coming together, we're going to be missing some key parts of the jigsaw to actually being able to promote, elevate, strengthen it. And my sense is that we're in a place, particularly in Scotland, that's the landscape I know best. We have some fantastic colleagues working in this space, and we really need to utilise them. And having initiatives such as this, which is involving colleagues from overseas, Maneesh, and colleagues from Scotland and wider, I don't know specifically the other colleagues in the call, but there is that opportunity for collaboration and ensuring that AMR really is at the forefront of not just the work we're doing now, but in the future, and its importance within those areas that I guess so far we've not been able to push into and get some traction. And one of the things I know, Till, you and I have talked about are care homes. And those practical places, so that it's not abstract, so that nurses can actually relate to those clinical practices and areas within which they function and work, and how they're able to take the knowledge and learning, and from an initiative such as this, giving the opportunity for our clinicians on the ground to be part of the solutions is a fantastic opportunity. And I hope one that everyone attending today either takes themselves or shares with other colleagues and spreads the word about the importance of this for us and what our role is in terms of our stewardship and our ability to promote, strengthen, and be part of the solutions. I think that's all I really want to say, other than it's so wonderful to be here, and I'm sorry I'm late again, and I'm happy to be part of any discussions. I have got to leave shortly, but I'm happy to stay on the call and listen to the rest of the session.
Thank you so much, Aisha. This is as always really important and good contribution. And we will take questions. And I have seen, oh yes, Laura already has her hand up. Over to you, Laura.
Trying to get myself off mute there. That was great talk there. And I've been part of the network with Scotland and across the UK. I think one of the biggest things that we're finding as nurses, and just acting as a bit of an advocate here, is that, you know, people are seconded into posts, and I spoke to the person who was working within the nursing homes and AMR, but then due to other pressures and other things, it's not prioritised, this work for nurses. So I just want to know how, as leaders, you can protect these roles for nurses and value that the work's being done, so that we can continue in these posts moving forwards. Because I just know it's quite disheartening for people who are doing this work and then the work's just suddenly stopped, or they're put back into some other role just because it doesn't feel valued. So I just want to know, as a leader, how we can protect those roles.
I'm happy to chip in first, if that's okay. Laura, it's lovely to meet you, and hopefully we can connect. Please just get in touch.
I'd love to do that.
Yeah. I mean, I think one of the not issues, but one of the challenges I think coming into this role is ensuring that the healthcare professions are valued full stop for their contribution, and ensuring that we ourselves are able to articulate what our value is. And I think there's some work for us to be done around that, and I would see that as part of my role in government and with wider stakeholders that I work with. I work with many organisations and clinicians in this role, and policymakers, and obviously advise ministers, which is part of my job with my team. And I think we do need to be able to demonstrate our worth. Now, how do we do that? I think we have to have one voice. I think we have to be very clear what the ask is and what our contribution is. And certainly, I think the argument is more around, we are not a cost, we're an investment. And, part of my role will be, I have two roles, as one as director for government, but also that professional voice. So I would certainly see that as being within my remit, to being able to hopefully influence, to be able to work with people like yourself, bring them to the fore, create opportunities, and be able to, I guess, hold that space and ground. Here's the thing, we are in very challenging times, probably the most we have been for some time. And there are these pressures ongoing. But certainly what I'm seeing from colleagues within government is a real push towards policy reform of how we deliver care. And I've just come off this amazing call with one of my colleagues around really actually taking action and seeing some change in, and that I think those changes in the system will in themselves create capacity despite the tight fiscal space. So I think there's a lot of opportunity for clinicians to be involved in the work where perhaps we've not been previously. And AMR, I think, is a really good example. The team that I have within CNOD are absolutely outstanding. And I keep talking to them all the time about how can we promote this work? How can we elevate it? How can we demonstrate the importance in the work that you do? And also to the wider public and population. How do we share our knowledge work, the importance of it, and engage in that space? I think these are some of the areas for us to focus on, but probably the biggest thing is having an opportunity for people to not be working in silos, but coming together and creating those spaces. So the work that Till's been doing around that one AMR network, who's in that network, and can we as a collective be working together? I think when we're in silos, it's very difficult to gain traction. But very happy to chat to you, Laura, and anyone else who wants to get in touch and hear from people on the ground who are doing great work, because I need to know you exist so that I can advocate for you.
Yeah, no, thanks very much for that. I just feel, we're talking about the 10-year plan, we're talking about the nurse's role, when actually they're the catalyst of all of this in infection, because they're the ones being, need to know how to take good diagnostics. They're the ones where it has a big knock-on effect. So actually, it's quite short-sighted, I feel, to not value that role and their position within AMS and AMR in, hitting all the 10-year plan of the government, what they're saying and what the vision is, when actually, if you get nurses involved, then we know that they're going to take better diagnostics, we get better treatment, higher quality of care, and faster discharges and back into the community, which is ticking all the boxes. So to say that there's no money for nurses because we can't see the value or we can't measure it, it just seems quite a short-sighted vision, when actually the bigger vision is that these are all the things that we want to be doing. So thank you very much for that, and I'll be in touch. Thank you.
And Laura, can I just ask where you're based?
Yes, so I'm over at the Northern Care Alliance over in Oldham, so the northwest of England. Yeah. So work with quite a few of your AMR, AMS nurses, and you are quite a lot in front of us with some of the stuff that you're doing. So it'd be great. But my vision is that all nurses should be taught in AMR and AMS as part of their core training.
Yeah. And I'll give a shout out to Duncan, the CNO for England here, because I guess this is his patch. I don't want to get onto his patch, but we were together last week, the 4 CNOs across the devolved nations, and we had this week. So I think it is about us. Although we're devolved as professionals, we are regulated nationally, and we all have our different policy briefs within our separate governments. But it would be good to I guess connect in with that team also, and I'm happy to facilitate that.
I'd be more than happy to do that. I've been trying to drive this for 3 years now, and we just keep hitting brick walls within organisation. It's been easier to run through BSAC, and I've had lots of support there, but it'd be brilliant to be able to get at those round tables and to really have a voice for nurses and midwives, but to have our own voice, not have anyone else speaking for us, but to be there telling them what it's really like to be on the ground floor delivering this care and what impact it has for us, given all these antibiotics, and actually, we can provide good patient care too. So it'd be great to be on that table and advocating.
Yeah, we need more Lauras then.
But this is what we generate here, so this is fantastic.
This capacity we need to build is having wonderful advocates like you, Laura, who are clinically credible and are able to support people in my role, and to be able to draw on your expertise and experience. And I'm sure the CNO in England would love to hear from you. I'm saying this, I do know him well, so he'll be like, really, Aisha?
It'd be great to contact him.
I can clearly see a need for a follow-up here, and this is turning into a very good Zoom call where we can generate some projects from this. But Laura, thank you so much for the question coming in, and Aisha again, and what you just said, you need more Lauras, and I think Fran and the LEAP program is producing. Sorry for the term, but that is the output from the program, is really raising awareness, raising skills, and making sure the contribution of nursing and midwifery is heard and is valued as a profession. And so that's contributing to all these. And it's obviously we are very UK centric now with our call. But I think the attendees and the reach, it's a global health aspect which we're addressing, and AMR is obviously a global health or global problem, a challenge, and the contribution of nurses around the world is really important. And my understanding is that Sophia, you have quite something to say in this direction. So I would like to hand over to you, Sophia, to say a few words to us. And Aisha, thank you so much again for your presentation today. Fantastic for your support coming from Nursing Now Challenge, and now in your new role and everything. This is really looking forward to further contributions and working with you.
Yeah, for sure. Thank you. I'll probably just nip off when I need to, but I'm really excited to hear from Sophia.
Absolutely. Thank you so much.
Oh, thank you. Oh, that's quite a big build-up now, but thank you. So I won't take long, but no, my name is Sophia Sachedina and I work at Global Health Partnerships, which was formerly THET. So if you've heard of THET, Tropical Health Education Trust, we're now called Global Health Partnerships, or GHP, for short. I've only got a couple of slides that I'll just share in case some people aren't familiar with it. Can you see that? Is it working?
Yes, it's not in presentation, but
is it in full screen now?
No. Yeah, now it's in full screen.
Okay, perfect. So at Global Health Partnerships, it's an NGO that is all about health partnerships between the UK mostly, and then countries across the world, mainly in Africa and Asia. But we're also looking at health partnerships that are south to south partnerships as well. So not just with the UK, but predominantly with the UK. So NHS or academic institutions. And really the work is all about strengthening health systems, building workforce capacity, and then supporting health workers across the world. I think we're currently working in about 15 countries, and the AMR program that I'll talk about works in 8 of those. And so the whole approach at Global Health Partnerships is about this model of health partnerships. So I won't go through all of this. But yes, we have different programs that focus on different areas of health. So whether it's health workforce training, capacity building, policies, guidelines, or thematic things like antimicrobial resistance. So we either work as a grant manager where we manage grants to health partnerships in the program, so health workforce strengthening programs or the AMR program that we have, or directly implementing projects in countries where we have country offices, so Zambia, Uganda, and Somaliland, and a couple of others. So the health partnership model, if people aren't familiar with it, is really about trying to establish these partnerships between health institutions, so hospitals or professional associations, academic institutions across countries. So we have primarily UK NHS trusts and foundations, or universities that partner then with similar institutions in the countries that the project's operating in. And there's a really big focus on the bidirectional learning. So not just the benefits that the country institution can learn from that, but also what the NHS or the UK institutions can also learn for like their NHS workers or within the institution as well. So we have quite a few case studies of examples where I think something around in Uganda, there was a mental health program that we were implementing between a Ugandan health institution and one in the UK. And actually the UK NHS volunteers who went over to Uganda, they, from what they saw about how mental health was being treated in the community in Uganda, then went back and implemented changes within their NHS institution based on things like that. So it's all about like reciprocal and mutual benefits. And ideally as well that the health partnerships are sustainable beyond the life of just the program that we're funding in that one moment in time. So the program that so I'm a program manager at Global Health Partnerships, and one of the programs that I manage is the Commonwealth Partnerships for Antimicrobial Stewardship, or CPAMS is what we call it. And it is funded by the Department for Health and Social Care underneath the Fleming Fund. So it's a direct grant from the Fleming Fund or from DHSC. So Global Health Partnerships manage the program, and we have a technical partner, which is Commonwealth Pharmacists Association, which is where I worked with Fran when she was in her role. So she was the technical lead, working with CPA on CPAMS, so was very familiar with the CPAMS program and involved in the delivery and design of the technical work streams that we had. I'll give a little bit of a background, because CPAMS has been a program that started back in 2018, so it has been going for quite a long time, and it has gone through various phases and iterations and things. So when it started in 2018, we had 12 health partnerships, and it was in 4 countries, 12 intervention sites and 24 organisations, and really was just about establishing those UK Africa health partnerships, focusing specifically on AMS and surveillance. And there was a lot of work that went into like developing the initial tools and the capacity building. We had a mini phase, or we call them phase 1.5, in between programs, which that one pivoted more to be about sort of the COVID-19 response, having to adjust the partnership approach to be sort of around remote working, because often it means actually either UK health workers going to one of the countries that we're based in Africa, or also having learning opportunities for some of the African health partnerships to come over to the UK and do learning and knowledge tours here. So having to pivot that to be a bit more remote as well. And a big focus on data collection in that phase. And then in our sort of phase 2 now, which has been going for the last couple of years, it's really expanded the program. So we've had 31 health partnerships. It's been in 8 countries. So that was Ghana, Nigeria, Sierra Leone, Uganda, Tanzania, Kenya, Malawi and Zambia, as well as the UK. Over 168 intervention sites and 215 organisations have been involved. So it's really scaled up in sort of its breadth and also the depth of the technical work streams. So CPA, they lead on the technical work streams. So we have things like the hub and spoke model, clinical diagnostics, substandard falsified medicines, and community pharmacy, which has become quite a big theme now in the next phase. And also shifting this focus from, we did a lot of data collection, like CPAMS has generated a lot of data, and the recent phase has been trying to pivot that to be like, okay, so what are we going to do with that data, the data for decision making, and using that within countries, so countries informing their sort of national action plans for AMR, the AMR committees at the national level, and those stakeholders to inform sort of policy change at national level, and also institutional changes at the partnership level as well. And we're currently in our final phase, which is phase 2.5, which will be finishing in March of 2026. And so we are sort of winding down now. And really the focus has been on just trying to consolidate everything that's happened over the last, 8 years, and embedding sort of the sustainability, country ownership. There's been a lot of sustainability initiatives that have been really successful, which is great, that will go beyond the life of CPAM, so beyond the funding, particularly between health partnerships. So I think there's a health partnership with Northumberland University and the Northumberland NHS. I need to remember the name of it, but I'll check it afterwards. And a hospital in Tanzania where they actually have monthly meetings where they go through and they have they're sort of like a brown bag type lunch of those learning opportunities where they can show something that they have had experience with, or learn from other things and sharing those, or questions and that sort of thing. So we've also got things like AMS ward rounds, or AMS committees at institutional level that will continue beyond the programme. So we're now really trying to focus on embedding as much as possible, both the sustainability work and also the technical work streams that we've been leading on. And we're also doing an evaluation of all of this, all of the work from the whole phase of the programme, which is being led by an external evaluator. And hopefully from that, we will develop an updated sort of impact report that can be used to show what impact CPAMS has had since its inception. And so I guess, yeah, a few more numbers, and won't dwell on all of them, but I think one of the really interesting ones that might be relevant for people here is the one in the bottom, around 3,400 plus volunteering days contributed by UK staff. And so that is primarily NHS workers who volunteer for their health partnership and either spend time providing technical support or actually going in country to their health partnership abroad and sort of either leading trainings or providing supportive supervision, mentorship, and that sort of thing, which has been both a great opportunity for the partnership, but also for a sort of career building and capacity development for their own personal and professional growth as well. And one last thing as well around the global health fellows. So there's 112 global health fellows trained as pharmacist leaders. And this will actually tie in quite nicely with what Fran was saying about the LEAP program and the mentorship and everything. So under CPAMS, CPA have been leading a fellowship program that originally in the first phase of CPAMS was a UK-based fellowship scheme for pharmacists. And it's all about leadership and governance, and they would implement a project within their health partnership and be part of a sort of fellowship cohort where they'd get trainings and networking opportunities. And then in the second phase of CPAMS, we did an African fellowship, so the same thing, but based in our African countries. And now for this final phase of CPAMS, it's really exciting that we've done a joint UK and Africa fellowship program. So each health partnership has one UK and one African fellow. And that's really, expanded the mentorship and learning opportunities of that fellowship program. And we've had recent fellows who have gone on to either work directly for CPAMS as part of CPA or be recognised nationally within the countries that they're working by the national stakeholders for the work that they have done. So I think it's also been a great way of sort of elevating their professional growth as well. And I think, I'll stop there if that's okay, and happy to take questions or anything on the CPAMS program.
Thank you so much, Sophia. And I think the build-up was absolutely justified. And so thank you so much for your presentation. It's an amazing program. And to me, amongst many things, one aspect which you mentioned is the bidirectional learning, which has been shown by this program, which is so important, and there's so much value in there, which we can obviously also apply to other aspects. But I think these between the countries is really, really important. The sustainability build-up, which you had also done over the period of the program as you're winding down now, but you said there's has been implemented a lot there. I think another really, really important perspective. We're running a little bit out of time, but if there are questions for Sophia, please do raise your hand. It's an exciting program, really, and has delivered so much. So if there are questions either from the attendees or not, I take it from the panel. Here you go, Fran, over to you.
Just thank you, Sophia, for sort of reminding me exactly what CPAMS achieved. It was a huge program, and actually, personally, it really developed my leadership career. And I think we really need to think about how we support healthcare professionals to really sort of develop a passion and their leadership career that often they don't get in the NHS. And that's what the CWPAMS program really gave people. And, I think don't underestimate the numbers and the impact that it's had on other people, and, exactly what people have done with being able to be involved with these sorts of programs. So I think it's just really to celebrate it, but to also think, how can we really take this forward into other programs, and the enthusiasm and exactly that bi-directional learning, what people can bring back to their own lives, especially when the pressures of the NHS and everyone's jobs are so high. It's difficult to see these other little golden nuggets of opportunity.
Amazing. Thank you. Thank you, Fran. If you don't want to respond straight away, Sophia, I hand over to Laura. Okay, Laura, your hand is up.
Yeah, sorry, it sounds brilliant, the work that you're doing. It sounds great. I was just wondering, was there any midwives or nurses involved in this programme?
So there have been, but it has been primarily focused on pharmacists. But I think that's one of the things that in this sort of later stage, we're trying to get, again, I think it's been mentioned around the multidisciplinary teams and the importance of that. And so in some of our health partnerships now, we are seeing more nurses and midwives that are part of the broader health partnership team. So although there might be a pharmacist that is, on the fellowship or leading the work, they are then bringing in their colleagues that are part of that team. And we did recently, we had a regional event in Kenya where we brought together all of the 8 countries and then the UK as well, all of those health partnerships to Kenya for a few days. And on the last day, we did these simulations, which were kind of like these escape rooms, but maybe not as fun. And it was like an AMR breakout on a ward and that sort of thing. And participants had to go through various stages. And there we noticed that we did actually have quite a breadth of the disciplines there. And it was good. In the group that I was in, we did have 2 nurses, and you could see the benefits of having them offer a different perspective. And so definitely it's something that we've been conscious it hasn't focused on as much, but it's sort of something that if we had done a further phase, we would have tried to integrate that a little bit more.
Thank you.
Okay, thank you so much, Sophia, for your presentation and contribution. As we all now said, it's a fantastic program, and obviously always a challenge if things have to wind down because of the funding situation. Okay, thank you again. Laura, I would like to give you the floor in our final few minutes before I then hand over to Maneesh to say something about our next webinar. So, Laura, floor is yours.
Thank you very much. So I haven't got a presentation today, unfortunately, but I think my big message here is that absolutely, again, nurses and midwives are pivotal in this role against AMR and AMS. And actually, we are a huge number worldwide, and we should absolutely be representing. So it'd be great to motivate and inspire our workforce to be able to come up with their own solutions to this problem. And actually that could be absolute key, but that's about giving people time to think and coming up, they're doing the job, the people doing the job should be coming up with their own solutions. So really, if you're a nurse and you're a midwife, listening today, really want you to think of how you could be impactful. And AMR and AMS, you're all leaders, everybody's a leader. How does that look? Is it that you're taking diagnostics today? What is a high quality diagnostic? Is it a reliable test? Is this patient, got comorbidities that's mimicking sepsis? Should we be looking at the counter argument? And how can we do that as professionals moving forward? So really sort of want to inspire people, especially, nurses and midwives, because I think there's a huge gap. When I examine people in the university, everybody knows how to escalate a septic patient, but actually I want you to think about how do we step these patients back down, because that is equally as important. And what solutions and how can you do that? How can you professionally challenge in a hospital that has got a hierarchy? How do you have a voice? So really want to try and look at motivation, but also look at bringing QI. And, the LEAP program is a great way to bring QI into your workload and actually get it as part of your job plan. It's a real sort of innovative way of bringing in the workforce and the greater team. So, if you are out there and you want to make a difference and you really want to impact and you don't feel that you've got a voice at the minute, really look at, coming on to contacting BSAC, because they are the people that will help you do that. And collaboration and anyone, you can email me, I'm happy to support, but, using your peers to support one another to make that difference in these difficult times. So yeah, leadership, you're all leaders, and but just thinking how we can make that better. And sometimes it's the simple stuff, isn't it? let's get those high quality diagnostics, let's get them sent off in a timely fashion before antibiotics are started. You know, if you're a triage nurse, get them done in triage. So they're just simple things, and actually they can make the biggest difference. So that's what I'd like to say today. Thank you.
Thank you so much, Laura. And yeah, this I think it encapsulates perfectly the role of nurses and the objectives with all your initiatives, but also this initiative we have here, why we came together here. And beyond that, what you just said, Laura, I think what struck me is that if this is seen by people who don't for recruitment, so people who are not yet nurses but want to enter into that profession, seeing the energy and the opportunities and the collaboration which we see today in this area, and there are many others, but I think this is really an amazing aspect which is which we covered today, and which we can see here. All right, so there is so a little bit activity in the chat, but I don't see a question straight away. So Laura, thank you so much again. Absolutely fantastic. And yes, as I said, Maneesh, I would like to hand over to you to say a little bit about our next webinar, which we have in January on the 13th.
Yes,
Maneesh.
thank you, Till. Thank you, Till. I think it was wonderful listening to all the 4 panelists, amazing feedback, and amazing comments. And I think one more area is, the nurse role in ongoing response to the process of a dialogue between the practice as it is and the practice as it could or should be. I think that's where in the future, the most of the contributions would come in, and we would have next time 2 speakers. One is Abdul Ghafoor. He's a consultant clinical he's an infectious disease clinician at Apollo in Chennai in India, and he convened the meeting at the medical societies in India in 2012 for the Chennai Declaration, and I think that made a significant impact. And this is a plan to tackle the challenge of AMR in India, and he was also part of the longitudinal prize advisory panel. And next, we would also have Raksha Bhatt. She's a clinical microbiologist and infection preventionist with special interest in mainly AMSP in hospital and community infection control practices. And she's passionate in community stewardship. And I think she's an amazing communicator, and I've seen a lot of her work online, and she does brilliant presenting the principles of antimicrobial resistance and the stewardship expected from various verticals. And of course, next week, on 13th of January, she'll speak mostly from the nursing perspective. Thank you, Tia.
Absolutely, and yes, those both individuals are a representative for the mentoring opportunities which we want to provide to the winners of this challenge. And I can tell everyone who is listening from the attendees is that we are receiving already inputs into the challenge, which is fantastic. But I can also see that there is more coming in then as we come closer to the deadline end of January. So thank you, Maneesh, for explaining that we have 2 further panelists or presenters next in the next session. We will also have Camelia Bogart speaking about the ESCMID, the European Society of Clinical Microbiology Infectious Diseases initiative on nurses, IPC nurses initiative. She will present about that. So again, another example where all these our understanding as we hear as a collective are then leading to these fantastic initiatives. So really, really good. We need to come to a conclusion today to end this webinar. I would like to thank really all our presenters again, Fran, Laura, Sophia, and Aisha, who's not with us at this moment, but really, really good, a really fantastic presentation. Thank you everyone for joining. Thank you, Martine, for hosting us today. And I hope I'll see you very soon again in our next webinar, and taking the nursing challenge, Nursing Now challenge forward to tackle AMR together. Thank you very much, everyone. Thank you. Bye-bye.
Thank you, everybody.
Thank you.
Bye-bye.